All right, well, I have 3 o'clock, and to keep with everyone's schedules, we'll get started. Good afternoon, everyone. My name's Liz Hess. I'm the KEMA Mentorship Committee Chair. So I lead these KEMA coffee break sessions. So I am the Central Regional Director of Emergency Management for WellSpan Health. I'm fairly new to that role. I started back in June. Previously, I worked in consulting doing planning, training, and exercises. My largest exercise to date was to design and facilitate a 3-day full-scale exercise on the Strategic National Stockpile with state, local, and federal partners. Recently, like I said, transitioned to my new role at WellSpan, consistently learning and love the opportunity to pull from all of you in this session and hopefully learn together. Selfishly, I kind of do these for my own education, but I also hope you all find benefit from them as well. So in case this is your first coffee break, coffee breaks started back in 2020. We saw a need for kind of engaging KEMA members as well as non-members within the field of emergency management. So they've been virtual sessions on and off whenever we have a good topic and a good group to talk about things. Our last one, I believe, was in June, so it's been a little bit, but I'm hoping to get back at them with a little bit more routine. And if anyone has ideas, is interested in being a co-host or wants to be a guest speaker, please reach out to me. I'm always looking for that. So the purpose of the KEMA coffee breaks is we're focusing on providing unique perspectives from practitioners within the field and any and all continual learners among the field. So today we have a great panel to talk about exercising, especially with all the competing factors of the last few years. So we have Bob Gerlach, John Williams, Cody Couch, and Ryan. And I'm going to let them kind of do a little introduction. Once we get to them, we're going to go in the order that they are seen on your screen. So Bob, we're going to start with you.
Great, thank you. First of all, as Vice President of the Keystone Emergency Management Association, welcome, and I thank Liz for getting us back to these coffee breaks. I'm currently serving as a training exercise coordinator at Allegheny County Emergency Services under the Division of Emergency Management. I've been in this position since about June of 2017. This year is my 27th year in public safety. I have some previous experience with law enforcement, the fire service, hazmat. I've been a paramedic, well, still am technically, in emergency management. I'm also a credit instructor for the Pennsylvania State Fire Academy, the Department of Health, Emergency Medical Services, and KEMA. A little bit of my educational background: I do have a bachelor's degree in administration, justice, and pre-law, and I have a master of public administration degree. Prior to coming to Allegheny County, I have served as a municipal director of emergency management, and I also worked for a couple of years as a contracted consultant for KEMA under the Safe Schools Planning Grant. I am a FEMA Master Exercise Practitioner, which was obtained in 2020, part of Series 48, and I do see a classmate on the list, so welcome. I've developed many tabletop, functional, full-scale exercises in the past, including an active shooter for the Pittsburgh Convention Center, also multiple schools. I was part of the sim cell for the statewide KEMA exercise in spring of 2020. And most recently, I assisted as part of the planning team and also served as a lead evaluator for our Veterans Administration National Disaster Medical System patient movement exercise. Thank you everyone for being here, and I hope I meet or exceed your expectations in today's discussion.
Hi, everybody. I'm John Williams, and I can assure you I'm not in the witness protection program. My background started in the fire service in 1980, so I've been in the emergency response world for a little over 41 years. I think that makes me sound real old. I worked as a firefighter at Harrisburg International Airport and ended my service there after 21 years as the fire chief of that department for 7 years. 2007, I went to work for a consulting firm in the Harrisburg area and worked primarily with healthcare organizations, counterterrorism task forces, county emergency management agencies. in my time period between 2007 and 2015, I managed about 150 or so full-scale exercises, mostly in healthcare, but across all different sectors. 2015, I went to work for Summit Health as the Director of Safety, Security, and Emergency Management at Chambersburg Hospital. And in April of 21, I transitioned after WellSpan and Summit Health merged. I transitioned to the role of Western Region Director for Emergency Management for WellSpan. So that includes Chambersburg, Waynesboro, and Gettysburg hospitals. And my educational background, I have a master's degree in education from Penn State and a bachelor's degree in fire service administration from the University of Maryland. Great to be here. Thanks for everybody else being here.
All right. Good afternoon, everyone. My name is Cody Couch, and I'm a senior consultant with Booz Allen Hamilton. In my time with Booz Allen, I've provided contract support to the FEMA Exercise Branch, the National Exercise Division, and the Office of the National Capital Region. I'm looking forward to our discussion today, and thanks for having me.
Hi, everyone. Thank you, Liz, for inviting me to be a part of this. My name is Ryan Coghill. My educational background is that I have a bachelor's degree in emergency management technology from the Pennsylvania College of Technology. In addition to that, I now work for M&T Bank as both a business continuity and disaster recovery analyst in two different forms, primarily as part of the business continuity world, working in technology recovery. So working over and overseeing, generating plans and maintaining approximately 700 plans for different pieces of hardware throughout our footprint at the bank. But also I am assisting in the creation of a crisis and emergency management program for the bank as well. So like I said before, Liz, thank you for having me here. And I'm looking forward to the discussion like Cody said.
Awesome. Thank you all. Very better introductions than I would have done. So thanks for that. Funny thing is, Cody, Ryan, and I all are alumni from Penn College. So that's some of the reason I asked them to join us today. So thanks for that. All right, let's get to the next slide. So these are the three questions that I kind of posed to the panel speakers today. And Cody, thank you for helping me as a co-host, kind of getting this all together. So each of them is going to take like 5 to 7 minutes and kind of answer these questions from their unique perspective and hopefully give us some specific examples and such. And then at the end, we'll spend a good half of the session just kind of with the Q&A, because I'm sure there's a lot of folks on the call that have great insights as well. So Bob, we'll start with you.
All right, well, when it comes down to leveraging your critical functions, lifelines, core capabilities, the basics are still the same. We still have to stay with the same format or the process is what I mean. My observation has been to limit our virtual tabletops to half the time you normally would do in person, just to gauge, because first of all, with this virtual or hybrid that we've moved to, and I'm sure everyone else in the meeting agrees, we have more meetings now than we ever did. When we had to travel to meetings, we didn't have as many. So we're going, so people have less time. We're trying to do more with less. You may require to get your objectives and what you need to accomplish done. You may have to have more exercises, but shorter length. Also think about improvement of communication, or how do you simplify exercise design. There are avenues for sharing or submitting forms, whether you use SharePoint, use Teams, Microsoft Forms, Google Docs. You could also do some of those in stuff like WebOC or some other similar platform to help with those type of things for submitting ICS forms as part of your exercise. It is possible to do a virtual functional exercise, in my opinion. That's all I have, Liz, to start at least.
All right, thank you. Ryan, for the first question.
Yeah, so this is a pretty interesting question because, like I said, I'm coming from the private sector, and specifically the majority of the work that I've been doing has been surrounding business continuity and technology recovery. And so I've only been there for a year, but I picked up pretty easily on how they were conducting exercises, because as I mentioned before, with technology recovery, we're dealing mainly with hardware throughout the bank. And as I mentioned before, we have approximately 700 pieces of hardware throughout our footprint that need to be planned for. So that's about somewhere of, think of it as 700 emergency operations plans that we have to maintain. And so for us, what we're doing is essentially what Bob kind of alluded to. We moved to for us, a purely virtual platform, because we were able to access the different pieces of hardware virtually through computers. And so recently, over the summer, we had our bank-wide exercise that lasted 12 hours, so a full business day, and we had all of our different critical pieces of hardware in our applications go through a simulated failover, which means some things occur, they have to fail over to their from their prod servers to their disaster recovery servers, and those app teams that are assigned to that have the knowledge, the engineers that are attached to those app codes and those pieces of hardware, the data centers, have to go ahead and try and bring it back into the production environment. So it was really interesting to see, because as Liz said, I have the background in emergency management. The way in which we were educated is the way, as I'm sure most all of you are as well. It's the, putting the vests on in the EOC and going through the exercise, or going to the location to oversee the actual, full scale exercise. Whereas for here, it was in my dining room with a computer and checking things off, contacting and having an open Teams bridge, we call it. So that was really interesting. But on the other side, working now to build the crisis and emergency management, because of my background, a lot of what we're doing, even though we're public sector, is a lot of the guidance that's being pushed is FEMA based. So a lot of the exercises, even the planning, as well as the HVAs, the whole process that comes before it is all FEMA based. And so, I'm not going to tell you anything that you guys already don't know, but we're beginning to follow that format as we build the crisis and emergency management program as well.
Awesome, thank you. All right, John.
So the question being that, how we leverage core capabilities, critical functions, and lifelines. And in the healthcare environment, we're focused on those critical functions that are established through NFPA 99 and obviously written into the CMS regulations and then written into the accrediting organizations documents. So one of the things I think that's important for healthcare emergency managers is to leverage those critical functions from NFPA 99, and because they form the basis for the CMS Joint Commission and DNB exercise requirements, can refocus on the baseline elements of those critical functions. So the communications, resources and assets, safety and security, clinical support activities, utilities, and staff roles. Recognize that we've seen that these same elements, especially communications, resources and assets, and staff roles, have still been challenging through COVID in a number of ways. So from a healthcare standpoint, we can simplify the exercise design process by going back to and starting with those critical functions as the foundations for all of our exercises. We should be doing that, obviously, anyway. If we don't get the critical functions right in our exercises, then we're really missing the point of why we do exercises. And again, from the healthcare standpoint, we can build the entire exercise and all of our exercise programs from those critical functions in NFPA 99. And I mention that again, because if you're a healthcare emergency manager, you need to be intimately familiar with, and it's section 125336 in NFPA 99. And NFPA 99 does a nice job of providing sort of a breakdown of each of the critical functions and really establishes some really good ideas for how as an exercise designer, we can incorporate those critical functions from NFPA 99. So I really think it's critically important that healthcare emergency managers especially be well grounded in that section of 99 and be able to apply that in every exercise design process that we're engaged in.
Really good points there. A quick comment from Rick. You really dislike the word virtual because they're real exercises. I think that's a very good point that we all need to keep in mind. Coming from before this role, working a lot with healthcare coalitions, doing exercises. They're like, well, is it functional? Is it full scale? And well, it's kind of virtual, but you know, if that's really how you're responding, then it's a real test and it's a real drill. So thank you for that comment. Cody, you're up next.
All right. So in terms of community lifelines to simplify exercise design, they can be used by providing scenario conditions that are aligned to the community lifelines. So for reference, there are 7 of them, of the community lifelines. So you have safety and security, food, water, shelter, health and medical, energy, communications, transportation, and hazardous materials. Typically, what we see is that we have a general scenario overview, which is then followed by our scenario conditions, which are aligned to the community lifelines, okay? So for example, under the general scenario overview, we'll identify the scope of the exercise conditions. So that means identifying the dates being used for the exercise, the threats and the hazards, and the areas being impacted. Then we'll follow on with the details specified to the community lifelines. So for example, if we're using a cyber attack, under the energy community lifeline, we can set the scenario conditions for a power grid failure and a blackout. Then for the food, water, shelter community lifeline, we can provide status updates to shelters and temporary housing. Additionally, you can then use the community lifelines to structure and frame your discussion questions, which should be helpful in receiving targeted responses you were looking for in terms of your exercise objectives and evaluation. So that's how you can really tie into community lifelines to your exercise design.
That's a great point. A really simple way of thinking through how to come up with those questions. Awesome. All right, so our second question is, when planning and executing exercises, what advice do you have for encouraging and prioritizing to the engagement of staff, given all the burnout that we're all so familiar with? Bob, we'll start with you.
All right, first, I just posted it back in the chat because it got buried by a couple. I posted a link to FEMA's virtual best practices guide. And then there's also an article from GovTech on exercises for in-person and stuff like that. So there's some resources for other people. But when it comes to planning or executing exercises, we still have to work with the established best practices of how we plan it, how we execute it. Always, don't just have an exercise to have an exercise. You have to look at your AAR and IPs, or after action reports and improvement plans for previous exercises or real world events, and evaluate, what are your priorities? What do you need to exercise? Whether it's a blue sky, gray sky, or black sky type of event. The key is to make sure there's an articulate or relevant reason for the exercise. If you're just having exercise, you're starting to lose your people from burnout from their already high workloads. Also, try to think of ways to really get engagement and spice up the virtual exercise, whether you're using polls, videos. I've even heard of some people doing games or contests, or they're entered into a contest as long as they filled out the exercise evaluation form, stuff like that. So, you really got to, and I hate to use the adage, think out the box, but we really need to come up with ways to do that. That's all I have, Liz.
Yeah, that's a very good point. All right, Ryan?
Yeah, so what I would say is that we're in the middle of a long-term activation right now, right, with COVID-19. And so obviously, I think that's all on our minds is when we're talking about how to prevent burnout. But when you're in a long-term activation like this, right, we're heading into the 3rd year, you tend to get blinders on. And for me, working in the private sector, in specifically the financial sector, I'm working daily with people who are not from our world. They don't have the same considerations. This is something, not that we're not worried about it as well, but it's something that's of a higher worry to them. They feel sometimes powerless. What they're working on daily is not contributing to the prevention or research to try and end the current crises that we're in. So It can sometimes, being in a long-term activation like this, can sometimes put blinders on including us, put blinders on all of us. And so the work and development and involvement in exercise design for disasters that do not revolve around what it is that we're currently activated for can kind of help break those blinders as well. So we recently did have to do a pandemic exercise where we had to go through our plan with internal stakeholders across the bank. That was something that we had a reprieve from the year before, but it was a financial regulation that we had to go through it. They weren't going to give us another reprieve, unfortunately. But however, like I mentioned, not only did we have the bank-wide technology recovery exercise earlier in the year, but for each of the plans that are due on a monthly, or the technology recovery plans due on a monthly basis, a mini failover exercise has to be conducted by each of these application teams. So when they are temporarily existing in this world of emergency management or business continuity, they are able to break away from that a little bit because they're focusing on something else other than what they're getting emails and announcements and messages on in a daily basis. So, you know, and for coming at it from a different point of view, from the public sector, well, not even that, even in the private sector, in what we do, there are things that come at us either slowly or really fast that have nothing to do with what we're already activated for and working on. And so for me, the world that I live in, it's primarily technologies. You know, your web and mobile banking might go down, which doesn't allow people to transfer money between, you know, friends and family members. That's added stress. And so those are things that we're working on. But those are also things that help break the blinders a little bit. Hey, we're not focusing on COVID all the time. We also have other things that we need to prioritize and worry about.
Awesome, thank you. All right, John, we'll jump to you.
Okay, hopefully I got the background noise situation resolved there. So with the question being, you know, what advice do we have for encouraging prioritization and engagement given the burnout with the ongoing response and high workloads in the healthcare environment? Right now, telling a nurse manager that she has to participate in an exercise or he has to participate in an exercise is really taking your life into your own hands. So the burnout is a huge issue right now, obviously in healthcare and a lot of other environments. So obviously our focus has been on COVID, and there's no getting around that for 2 years now. And I think one of the things that we have to emphasize in discussions when we are trying to get exercises back onto the discussion for priorities is that the other types of emergencies that we have to respond to and that will occur have not stopped occurring during COVID. And in our health system alone, since March of 2020, we've had multiple different events, unplanned IT downtime events, several fires, including a fire involving an MRI unit at one hospital, protest events, power outages, hazmat releases. So these events have not stopped. There's no off button. And I think when we start to look at how do we encourage folks that are burnt out that they need to participate in our exercises, is again, the bottom line is that these other things have continued to occur and we need to be ready for them. We need to be prepared. So as far as in a pre-COVID world, in the healthcare arena, again, it's probably not likely that most hospitals would have been able to exercise all of the possible types of incidents that show up in your HVAs. So now that we're going back into it and trying to reprioritize again, it's going to be that much more critical because we've basically had, you know, a lot of difficulty in doing exercises, if we've even done exercises. In the healthcare environment, the level of burnout is incredibly high. We've had turnover of staff. We've had staff just basically walk out, and so their stress levels are just through the roof. So we have to recognize that we're going to have to do a lot of effort, put a lot of effort into convincing the powers that be in our hospitals that we need to get back on that horse and ride again, basically. I think the point that Bob made earlier about making better use of tabletop activities and decreasing the amount of time that we spend in those activities, I think will go a long way, not only in those other environments, but certainly in the healthcare arena, to try to be able to sell the idea of getting back into doing a regular exercise program. I think if we can do things like brief seminars where we focus on a very specific topic and focus our attention and focus our time to sort of compact that learning into as small period of time as possible, is going to go a long way. So we have to leverage the incidents that have occurred, share stories amongst the different healthcare systems, and make use of the fact that these other incidents have not stopped in the meantime, and that things are going to continue to occur. So we have to get back into that program of regular exercising.
Yeah, great points there, John. I know, John, you and I have had discussions, and Ed Bob, our other counterpart, about kind of coming back to those critical functions of what are the fundamental functions of every exercise and every response that we might be doing now with COVID, that we can have those discussions and remind people, okay, even after COVID, these functions that we learned how to do really well, how can we continue that into those everyday emergencies? Great points. Go ahead, Cody.
All right. So 2 points I would stress here would be consideration of virtual or hybrid exercises, and also the consideration of downscoping large-scale exercises to more targeted engagements. So utilizing the virtual or hybrid environment could be the determining factor if a key component decides to participate in an exercise or request that their play is simulated. And of course, if they have to be simulated, then that creates extra work for us as exercise designers. So nobody wins in that situation. This can be beneficial to the planning process as well. So when you're thinking about all the planning meetings that you need to have and whatnot, that can be used for a virtual environment or hybrid. It has to, it'll cut down on your travel times. It cuts down on having to bring everybody together. If you have capacity constrictions due to COVID restrictions, the virtual or hybrid environment definitely helps cut that out as being a factor. So the second part of this was the targeted engagements. Lead-up events have been largely beneficial to us, opposed to just bringing all of our stakeholders or customers together for one giant operations-based exercise. To that point, every exercise does not have to be an extravagant full-scale exercise. So instead, perhaps maybe shifting focus to smaller multiple targeted engagements, which can help your stakeholders or customers prioritize their participation, and you will likely see greater participation from all of them as well. So I think it was Robert who had mentioned when doing the virtual tabletop exercises, instead of doing an 8-hour tabletop exercise, maybe perhaps you're cutting it down to 2 or 4 hours. Another thing is that instead of having the full-scale exercise, perhaps you scope down to maybe 3 discussion-based exercises, and all of them have a targeted audience. So that way you're focused in on who your components are for each of those exercises. And then that also allows flexibility for your customers or stakeholders that are involved, so that you're, instead of taking them away from their daily duties for a week to do a full-scale exercise, they're only having to find 2 or 4 hours of their day to participate in a virtual or hybrid event. So those are my 2 points there.
Awesome. Yeah, I know our some of my facilities participated in a county exercise with York County, and they did a fabulous job of doing kind of that hybrid approach. It was a shortened length of an exercise. They sent out injects via Everbridge, which was awesome. So it was a way to have those discussions and know that other people might be available for that phone call to ask them questions, and still not take a ton of time out of the stuff that needs done on a day-to-day basis. All right, so coming to our last question for the panel is how can we take all of this that we've been learning the past several years and turn it into an environment of continual improvement? So how do we take our after action reports, our improvement plans, and really adapt them as we move forward?
Well, Liz, I really think nothing changes. The event, whether it's an exercise or real world, happens a little differently, whether you're hybrid or virtually activating your EOC or doing the exercise. It's just how you capture the information. Instead of having those paper feedback forms, you're going to do a lot more by email or Microsoft Forms or Google Forms. That might make the process take longer. Also might take work. You might have to, as I say, turn into a dentist, pulling teeth to get that information from people because their workload is so increased. Your request might end up on their back burner. But when you're evaluating what you should do for continuing improvement, always evaluate your after action reports and IPs. Look at your real world events, evaluate your critical functions are both internally and externally, and how things can affect those and maybe even disrupt them. One of the things I know whenever I was consulting with school districts, one school district that I learned this from, they started to have what they called mini tabletops. And maybe once a month during their weekly briefing with all their administrators from all the schools, the superintendent would say, okay, here's a scenario, what if? And limit the discussion to 5 to 10 minutes, and it would be anything from weather related to anything, but it's like not a complete scripted tabletop, but it gets a discussion going and gets that gray matter going. It's a quick 5 to 10 minute discussion where everyone in the administration can discuss it. And even just having those discussions creates a movement towards continual improvement. Because if you don't have that buy-in from the people that you were working with, they're not going to participate. So that's also those mini tabletops, as they would call them, could be help creating that buy-in for continual improvement processes.
Awesome. That's a great example. I know my team has been working towards doing kind of a monthly 10 to 15 minute discussion with our teams just to, keep stuff fresh. I think that's great. Go ahead, Ryan.
Yeah, so when I saw this question, it really got, like Bob said, my gray matter moving and thinking. And the way that I would be approaching this is largely through a culture shift, which I know is simple to say and extremely hard to actually execute. But one of the ways that, or really not even one, but the first way that I thought about it is education through involvement. So the world that I live in, just replace your mayor, your town manager, your council members with chief information officers and chief financial officers and CEOs. They all have the same mindset, which is I have something larger to run. Why is this one little group of people over here keep poking you with a stick to be involved in this some way? And largely it's for the greater good in corporate America, in the private sector. Everybody wants risk management until largely you kind of have to deal with risk management. And so education through involvement is something that at M&T we've really kind of taken the reins on. We're trying to involve as many people as possible. And luckily we've gotten a really good response back as well. We have not just one, but multiple executives that are not only waiting for us to reach out to them, but are reaching out to us continually, I mean, weekly, to get, how can we support you guys? How can we get involved? Because this is something that they truly value. So just getting more support, getting and keep pushing the boundaries of what you're doing daily through exercises, plannings, HVAs, et cetera. But again, it comes down to this culture shift of education through involvement. And that works on the opposite side, or the opposite side of the scale as well. I deal with a lot of technology engineers, and they want to live in their own world, and they're really good at dealing with the hardware and working in the data center. But by involving them and getting them educated on it and involved in the process, we're educating them on why business continuity and crisis and emergency management is a very big part of the process, as well as specifically the focus on exercising. M&T is a large corporation. It's a global corporation. And so there are always things, small and large, that are have the potential to go wrong, that are hazards and risks. And so truly through the exercises and involving these parties, both executives and the quote unquote worker bees, we're moving towards a better resiliency towards a lot of the hazards and risks. And it's through the exercise and the push and the focus on exercises.
Great. I love that education through involvement perspective. That's a great point. All right, we have John next.
Yeah, so great stuff there. And I would echo Bob and Ryan, and then also Laura Kirk mentioned on the chat, and I think somebody else just brought something up on the chat, and that is that the value in doing just very brief talk through sessions, as Laura put it, and using those as a powerful tool, especially in our current environment with everybody's got too much on their plate already. They don't need one more thing, and here we come with one more thing. I think that's huge. So in healthcare, those of us that work in the healthcare environment know that we have a regulatory requirement for continuous improvement. The CMS regulations require us to do that, and hospitals have specific departments of people that do just that. They work specifically on continuous improvement. So I think in the healthcare world, we have to make sure that we have them in our hip pocket and they have us in their hip pocket, and we're working together on a daily basis to make sure that activities that are occurring, whether it be real world incidents or as we do get back into doing more exercises, that we're working towards not only completion of those regulatory requirements, but also getting value out of what we're doing. Even if it's real world incidents, getting value in the learning that comes from those. So the other points I think that would go along with that is making sure if we want to have our exercises result in a continuous improvement cycle, we have to make sure that they're well designed and they're thoughtfully conducted in order to make sure that we're getting every ounce of impact out of the efforts that we're putting into them. So I think as we get into reestablishing a regular cycle of exercises, including obviously thorough evaluation, reporting, and improvement planning, we can work toward an environment of continuous improvement, at least in those areas that we as emergency managers are specifically responsible for, and then also trying to influence those areas that we might not be immediately responsible for. I think another point that we could bring into this part of the discussion is if you're not currently using lean management principles, I think that is a huge part of that idea of having a continuous improvement culture. Is if you're not involved with lean, if you're not using those types of principles, it is something that you definitely want to take a look at. Lean is all about continuous improvement, and it's all about doing continuous improvements in small bite-sized pieces. And that's really what we need right now, going back to the idea of doing more shorter duration, higher impact activities. So I think that's where we can take that part of the discussion.
Awesome. Thanks, John. Yeah, fabulous point there with the lean management processes and principles. It's amazing how many fields way outside of emergency management that we can learn a lot from. Go ahead, Cody.
Okay, so the biggest thing to remember here is that exercises do not include at end X. Okay, so just because we receive an inject that says end X, that does not mean that from an exercise standpoint, the exercise is over for us. To create an environment of continual improvement, we have to complete the entire exercise cycle. Evaluation is key to continuous improvement. It is important to stress to the players that the exercise is not being used to evaluate their performance or deficiencies, as the exercise is a learning and no-fault environment, but rather to identify strengths, planning gaps, and areas for improvement. The Homeland Security and Exercise Evaluation Program, known as HSEP, tells us that an exercise is used to validate a plan, policy, or procedure. So let's do that. So we need to follow through with evaluation, develop our after-action reports and improvement plans, and put them to use. I think it was Robert or somebody else on the panel that had mentioned we don't exercise just to exercise. We exercise for a purpose, which is either to validate a plan, policy, or procedure. You can't do that unless you follow through with evaluation and continuous improvement. So if you don't have that link, if you just get to the end of the exercise and call it a day, then basically we just had an exercise to exercise. We need to follow through with the complete exercise cycle.
Awesome. That was spot on. Exercises don't end at index. I love that. I know it's also very easy to have the improvement plans, put them on a shelf and not look at them again. So now we're going into the open discussion part. So I'd love to hear from anyone in the audience that has some input, but does anyone have any best practices for how they continually review and update their improvement plans? You can get off speaker and talk, or you can put it in the chat.
Hey, Liz, one thing I'll start off the discussion. Your improvement plan has to assign a person with the responsibility with a deadline. Other than that, it will never get done. I see some heads shaking up and down.
Hey, Liz. One thing that I would offer up here is that one thing that I've learned from an exercise design standpoint is that the utilization of an objectives database has really helped us out. So the beauty of this is that not every exercise needs to be designed from scratch. So we make life a little easier by using a database for all of our past objectives that have been exercised. This way, the objectives can be identified very easily, and we can identify them as being successfully completed, or as if they need to be exercised again due to some planning gaps or improvement plans that need to be addressed. So like I said, one thing that has really helped us out has been using an objectives database, and I would encourage anybody else to do as well.
Hey, Liz, this is Bob Ross. I really appreciate listening in and all this wisdom that's here. It's really great to hear everybody's thoughts on exercises. My thoughts go to a couple of points that as a consultant that we don't always see, but we encourage regardless, and it's been spoken of here. Number one is that when you're testing a plan, and is the understanding that folks coming to the exercise have to understand what the plan is. And it's very hard to do an exercise when nobody knows what the plan is. So that pre-exercise activity that's necessary to make sure that folks have a general idea at least of what they're there for, what they're going to do. And the other side of this is alluded to because we hear it in the exercise field is like, well, we've exercised this before, but nothing's ever changed. So that certainly goes to the several comments that have been made by Bob, Ryan, John about continuous improvement and the necessity that the exercise actually affects in some kind of change, hopefully for the better. Thanks.
Great. Thanks to hear from you, Bob. Great points.
Hey, Liz, there was a question there in the chat that I wanted to address. I think it was Denise there. She asked the best place to find an objectives database. For us, we just use a generic Excel spreadsheet. So what we do is we will, in the first column, we have the objective. And then in the next column, we identify as to if the objective was SMART or not. And then if it was not, in the following column, then we explain why it was not and what needs to be done for the next time to make that objective a SMART objective. So SMART being specific, measurable, achievable, realistic, and time bound. Okay. Then the follow-on, we note in the following columns as to if it was successful or not, and if we plan on using it for further exercises. So that's when I say objectives database, I don't think that there's really a template out there for it. That's just how we have put it together ourselves.
Awesome. Thanks for sharing that, Cody. That's a great point.
And along those same lines, within our health system, we've started to share across our all of our hospitals. We've started to share that idea of a database that we share the exercises, and therefore we share the objectives as well.
Yeah, Liz, I can back up what Cody's saying. From my perspective, we have two ways that we go about this. For exercises, we have something called issues management, and that's located on a SharePoint. I'm not sure how familiar everyone is with SharePoint, but it's part of an internal website that all M&T bank employees have access to, and so everybody is able to go in there and see, tips and tricks, information that we put out as a unit. But in there, we also house our issues management for our exercises. And we're currently working on building a separate issues management for real world exercise, or not real world exercise, but real world incidents, because there are issues that come up during those. And while it's unfortunate that they happen, incidents are also, exercises. That's what we are simulating when we do an exercise. So that's something that we're currently working on as well. But again, that's internal. There's no, like Cody said, there's nothing that we kind of stole from or co-opted to be our own.
So to the larger group, I'm curious if there are any folks who primarily serve as players in exercises or have in the past, that from that perspective, do you have any suggestions on how folks can design exercise differently?
Liz, one thing was just put in a chat from Katie, addresses some of that, where you need to have more people in the background for you. One thing we established here in my organization is when we did virtual training, not only did you have the instructor, but we had a producer, somebody who was monitoring the chat, controlling the people that are able to unmute or whatnot, and then just doing the background stuff. So you do need more people for that. She also mentioned how online feedback forms are helpful. One thing I found even pre-COVID was online forms were good because whether it's Google Forms or Microsoft Forms, you get those nice graphics with the charts that help out sometimes. But then she also brings up about those holding exercise for shorter periods of time. So I think those were three great points that I think addressed some of your previous question you just made. I don't know if anyone else has anything to add to that.
Hey, this is Katie from NOAA. Can you hear me?
Yeah, you're good, Katie.
Okay, perfect. Sorry. One thing that I noticed, I'm very rarely a participant in exercises, but I filled in for a coworker in a Coast Guard prep exercise. And I found it interesting from a design perspective. When we got to the hot wash, the facilitator for the hot wash gave his opinions first on what went well and where the gaps were. And after he got done talking, which he had like 3 key points, the rest of the hot wash took maybe 5 minutes because nobody seemed to want to share anything else. He summed it up for what we were all thinking and didn't really engage us in a conversation. So from that perspective, I think that it's important as designers and facilitators that we pay attention to asking our participants their thoughts and feedback first from how the exercise went and what we can do better or where the gaps are. And then when it gets to a point where there's a lull or you're coming up to the end of the time for your hot wash, then we as the designers and facilitators provide our feedback on what we think. It's the shortest hot wash I have ever been in my entire life.
Oh, that's crazy. Yeah. I mean, as an exercise facilitator, really, you're not supposed to opinionate. You're supposed to collect the data. I mean, instead of opinionating, maybe later in the AR process, you're supposed to be a coach as a facilitator. So if you hit that lull, the facilitator should have these questions or comments or some ways of creating engagement from the participants. Sometimes that can be
absolutely.
Yeah, sometimes it can be difficult and goes back to being a dentist and pulling teeth, like I said. And it takes practice. I mean, I'm still not an expert at that and have some issues. It just takes time. But yeah, I can't. Yeah, a short hot wash is not a good hot wash.
So I just want to acknowledge some of the questions people put in the participant sign up form. So we had someone ask about, this is slightly off topic, but best ways to learn how to create a disaster plan. So I have that one noted for a potential future session about like how to get started, whether you're a new organization or building on an existing platform, of kind of how to get started into preparing and developing your plans. So that I'll tuck away for the future. Someone asked, and I think we somewhat touched on this, is leveraging online participation. I'm wondering if they're asking, how do you actually get people to the session? Does anyone have any insights on that?
I think that's harder and harder with the increased workload, people are going to come to what they see a purpose for. It's so much easier to say, okay, that meeting doesn't affect me. I don't need to go to that one. I want to change a little bit topic, going back to your first question, for just in case that person's on here and they're not aware of, there are 2 good classes to get started with. The independent study website has IS 235 emergency planning. There's also the in-person G235. Also, if you Google search FEMA and planning for schools or faith-based organizations, you're going to find guidebooks to get more discipline specific. So I just want to get that to help that person out if they are on the line here.
Yeah, and Liz, so there was, I think it was Rick asked me a question in chat and I missed it, but the objectives database is not an ed product, so unfortunately I'm not able to share that specific document. However, I went through the steps a little bit earlier, so it's pretty simple just to put together in a generic spreadsheet. And then to the question of leveraging online participation with in-person exercises. So we, even like pre-COVID, we utilized hybrid participation for exercises. Just sometimes you're limited due to venue capacity. So a couple options that we've used to approach this is to consider only having your key players and your control staff in person, while the evaluators or data collectors are attending virtually. Okay, so of course you'll have to work out some logistics to make sure that those who are attending virtually can hear the in-person conversations. So rather it be through a conference line, virtual platform, where you have mic runners, so be it. But another option would be to for those who are going to have limited exercise play, they can be the ones who are attending virtually opposed to in person. So for some of our exercises, we'll have what's known as a white cell. Okay. And the white cell, these are typically like your subject matter experts who are not your key players or known as your blue players in the exercise, but more so your subject matter experts from your emergency support functions, or perhaps maybe at the local level, like your community stakeholder partners, who would be called upon to provide that subject matter expert level input that would be needed for response level from the blue players. So for our white cells, perhaps they could be attending virtually, as they'll only be participating as needed or called upon by the blue players. So that's some ways in the past, even like I said, before COVID, that we've introduced online participation during in-person exercises.
Yeah, those are fabulous ideas. And I think kind of coming back to Bob Ross's point of the meetings before the exercise, or emails, or however you're communicating the purpose of the exercise, I think can also encourage people to participate if they see why it's relevant and why it's important. We have about 5 minutes left, so I was just going to kind of open it up to any general discussion if anyone has anything else they want to talk about.
Hey, Liz, I want to add one to John's list of materials for developing plans. That's CPG 101, FEMA's Comprehensive Preparedness Guide 101.
Fabulous tool.
It was just real quick. So Robert, to your comment there in the chat, as for needing more background staff and help with the facilitation and data collection, one thing that I found has really helped us through our exercises and using a virtual or hybrid approach is having a roles and responsibilities document. So this document will highlight everyone who will be in that control position or facilitation, data collection, what their roles are, when they'll be expected to be dialed into the exercise if they're attending virtually or in that hybrid environment. So like I said, roles and responsibility document goes a long way. It's the level of effort is worth it.
Yeah, that's a great point. I know I've gleaned this from previous exercises that if you're not quite sure if you want to take the time to join and you have any questions about what your role is, that can be just enough to cause you not to join and participate. So yeah, roles and responsibilities and clearly explaining that is important.
And Liz, I think one question that I saw sent to us from the registration was about what to do if during a planned exercise there's a surge of patients or staff don't have time to participate. So my suggestion here would be to form a core planning team during your exercise design and development phases. And basically in your core planning team, have your leads or heads of the departments that will be participating in exercise as part of your core planning team members. So obviously they're going to know, all of the information about the exercise, but it's their responsibility as a trusted agent to keep that information close hold. But by having these people engaged in your core planning teams, you can identify an exercise conduct date that would be beneficial to everybody that's going to be playing into the exercise. And another thing that you can do is establish a contingency date as well. The one thing I would caution to is to hold tight to your planned original exercise conduct dates as much as possible and set parameters for when it's okay to push that contingency date. Because if you don't set parameters to push that contingency date, then you may be planning an exercise that never happens. So that's the important part about having that backup date, is that you need to have those parameters in place and say, okay, we've checked off 8 of the 10, that meets our criteria, then we're good to go.
Awesome. All right. So since we just have 2 minutes left, I'm going to turn it over to Bob to wrap up a few KEMA things, and then we'll go from there.
All right, thanks, Liz. First off, for those of you that either within or outside of the Commonwealth of Pennsylvania, we are currently in the middle of our KEMA conference. It's a virtual on demand, so it's you can take or watch the presentations as you wish. It's KEMAconference.com, and I have the link in the chat. It will be open for about 5 to 6 more months. We will send an idea. We might be able to get it extended at no additional cost, and if so, we will do that. Also, if you are in the Commonwealth of Pennsylvania and not a member of KEMA, if you go to KEMA-PA.org, It's only $30 a year to be a member, and we would like you to be part of our organization. Finally, I want to turn over to President Mertz, see if he has any closing remarks before we call it a day.
Well, thank you, Bob. And first of all, to Liz, outstanding job putting this together. To the panelists, outstanding dialogue, good information, and I thank you. It's been a tough 2 years for KEMA, as well as everybody else, but for KEMA trying to meet our mission, and throughout the pandemic, with everybody and the extra workload that they had, as well as the distancing and those type of situations there. Liz has knocked it out of the ballpark for us, because throughout the whole pandemic, she has been putting these coffee break sessions together and helping us meet our goal of education going forward. So I just want to acknowledge that. KEMA is not a group of county emergency management directors or locals. It's a group for emergency management professionals all around. I was thrilled to look at the attendance of today's roster, to seeing that diverse group of communities. We had education and healthcare and everything else that was involved with this. And that's really what we truly want to hit, is emergency management professionals. Because we start working together at multi-levels, multi-disciplines in emergency management, which KEMA can provide, then when the times get tough, the skies turn dark, we'll be able to work together then. So thank you all for your participation, and I hope to see more of you and more of these coming up in the near future. Thank you again, Liz.
Robert, could you give me that link again to the KEMA? You went so fast.
Which one? The KEMA
The one to join.
to join, I just put it in the chat if you want to check. It's KEMA-PA.org, but I also put it in the chat.
I did see that, but I don't see I'm looking at the website, but I don't see anything. I guess maybe home. No.
Hold on, I believe it says membership or under join. Yeah, if you look KEMA-PA.org,
Mhm.
next to the home says join KEMA. If you click on that, it'll give you the information.
Okay, I'll look into it. Thank you.
You're welcome. And thank you.
All right, with that, I just want to thank all our panelists. This was a great conversation and a great way to get back into these KEMA coffee breaks. So stay tuned for future ones, and please let me know if you're interested in being involved. I'm going to stay on for a few minutes, but everyone else have a great day.